Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss what Attention Deficit Hyperactivity Disorder is, DSM-5 diagnosis requirements, symptoms of inattention, symptoms of hyperactivity, impulsivity, ADHD and epilepsy, and treatment options. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified of future videos. Please click our donate link in the description section below and donate today. Your donation helps us to make a difference for those battling epilepsy. We appreciate your support. Attention Deficit Hyperactivity Disorder, also known as ADHD, is often diagnosed in early childhood and continues into adulthood. Children and adults can have trouble paying attention, controlling impulsive behavior, and can be overactive. According to the American Psychiatric Association, ADHD is considered a chronic and debilitating disorder that can impact an individual in many ways. Academic and professional achievements, relationships, and daily life functions are examples of how ADHD can impact someone. About 8.4% of children and 2.5% of adults have ADHD. According to the Centers for Disease Control and Prevention, the DSM criteria for ADHD focuses on inattention and/or hyperactivity. A primary care physician will send a patient for an assessment done by a child or adult psychiatrist or neurologist. Along with a diagnostic interview, questioning family members about symptoms can help in assisting to make a proper diagnosis. Children up to 16 years of age must display 6 or more symptoms for a minimum of 6 months. Individuals aged 17 to adulthood must display 5 or more symptoms for a minimum of 6 months. Symptoms include often fails to give close attention to details or makes careless mistakes in schoolwork, work, or other activities, has trouble holding attention to task or play activities, does not seem to listen when spoken to directly, often does not follow through on instructions and fails to finish schoolwork, chores, or duties, often has trouble organizing tasks and activities, often avoids, dislikes, or is reluctant to do tasks that require mental effort over a long period of time, often loses things necessary for tasks and activities, is easily distracted, is often forgetful about daily activities. Children up to 16 years of age must display 6 or more symptoms for a minimum of 6 months. Individuals aged 17 to adulthood must display 5 or more symptoms for a minimum of 6 months. Symptoms include often fidgets with or taps hands, feet, or squirms in seat, often leaves seat in situation when remaining seated is expected, often runs about or climbs in situations when not appropriate, often unable to play or take part in leisure activity quietly, and often on the go, acting as if driven by a motor, often talks excessively, often blurts out an answer before a question has been completed, often has trouble waiting their turn, often interrupts or intrudes on others. In addition, the following conditions must be met. Has many hyperactive, inattentive symptoms before age 12, symptoms present in 2 or more settings, clear signs that symptoms interfere with daily functions, symptoms not due to another disease. Children are at higher risk of having seizures if they are diagnosed with ADHD. Around 14% of children with ADHD are at an increased risk of being diagnosed with epilepsy. Children with epilepsy may experience cognitive behavior and emotional difficulties. According to the article, ADHD and epilepsy often co-occur. Here's what experts know about the link. The following neurological differences can lead to certain ADHD symptoms. Less thalamus volume. A small 2012 study suggested that fewer nerve fibers coming out of the thalamus may lead to inattention symptoms. Less gray matter in the frontal lobe. The frontal lobe helps you to make decisions. A small 2016 study linked less gray matter in this area to the inattentive subtype of ADHD. Less brainstem volume. If you have a smaller brainstem, you may have a harder time staying alert. For patients with epilepsy and ADHD, medication is one form of treatment. Precautions must be taken due to some anti-convulsive medications that can cause symptoms similar to ADHD. Medications that can exacerbate ADHD symptoms are phenobarbital, topiramate, valproic acid, phenytoin. Medications that can help improve ADHD symptoms are carbamazepine, lacosamide, and lamotrigine. According to Mayo Clinic, psychostimulants are the most commonly prescribed medication for ADHD. Psychostimulants help to boost and balance neurotransmitters, improve signs and symptoms on inattention and hyperactivity. Psychostimulants used to control ADHD are amphetamines and methylphenidates. In conclusion, according to the American Psychiatric Association, ADHD is considered a chronic and debilitating disorder that can impact an individual in many ways. Inattention, hyperactivity, and impulsive behavior are common symptoms. People with ADHD are more likely to develop epilepsy. Anticonvulsants and psychostimulants are common medications that people with ADHD and epilepsy take. To learn more about Attention Deficit Hyperactivity Disorder, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos and subscribe today. You have the power to defeat epilepsy.